Did you know that according to the World Health Organization, over 55 million people worldwide are living with dementia, and that number is expected to double every 20 years? What's even more alarming is that everyday habits, common medications, and even the way you sleep could be silently affecting your brain health. In this video, we delve into 5 compelling topics to help you understand and protect your cognitive function. From uncovering 10 common medications linked to cognitive decline, to identifying the early signs of dementia, exploring the surprising link between sleep and brain health, breaking down the different types of frontotemporal dementia, and revealing the best foods to detox your brain. Let's begin with 10 common medications linked to cognitive decline. Have you ever wondered if that little pill you take every day could be affecting your brain health? Imagine this: you've been taking a medication for years, trusting it's helping you, only to discover it might be harming your cognitive health. Today, we're diving into a topic that affects millions but is rarely discussed: medications that could potentially lead to dementia. Stay with us as we explore 10 common medications linked to cognitive decline. Understanding these risks could change how you manage your health. And make sure you watch until the end, because medication number 8 is the most surprising and widely used. Medication number 1, benzodiazepines. Benzodiazepines such as Xanax and Valium, commonly prescribed for anxiety, insomnia, and stress-related disorders, have been linked to an increased risk of dementia. Medications like diazepam and lorazepam work by enhancing the action of gamma-aminobutyric acid, GABA, a neurotransmitter that produces a calming effect on the nervous system. While effective in the short term, prolonged use can lead to significant cognitive risks. Research indicates that long-term benzodiazepine use may interfere with normal brain function, potentially impairing memory and cognitive processes. For example, a French study involving over 1,000 elderly individuals over 15 years found that regular benzodiazepine users had a 60% higher risk of developing dementia compared to non-users. The physical and psychological dependence that can arise from these medications further complicates matters, making it challenging to discontinue their use without medical supervision. If you or someone you know uses benzodiazepines, discussing the risks with a healthcare professional is crucial. There are alternative therapies, such as cognitive behavioral therapy, CBT, that can effectively treat anxiety and insomnia without the dementia-related risks. Transitioning to these alternatives requires careful planning and monitoring to avoid withdrawal symptoms and ensure treatment success. In light of these findings, it's essential for patients and healthcare providers to critically evaluate the use of benzodiazepines, especially among older adults who are more vulnerable to adverse effects. Considering therapeutic alternatives can safeguard cognitive health while effectively managing anxiety and sleep disorders. Always consult with your healthcare provider before making any changes to your medication regimen to ensure safe and effective treatment. Number 2, anticholinergics. Anticholinergics such as atropine, hyoscyamine, methscopolamine, and scopolamine, a common class of drugs, are often used to treat conditions like allergies, urinary incontinence, and Parkinson's disease. They work by blocking the action of acetylcholine, a neurotransmitter essential for memory and learning. Despite their effectiveness, there's growing concern about their impact on cognitive function. Studies have shown that prolonged use of anticholinergics can lead to cognitive decline, particularly in older adults. Acetylcholine plays a crucial role in brain processes like memory formation and retention. When its action is inhibited, as with anticholinergics, it can lead to memory problems and even increase the risk of dementia. A study conducted by the University of Washington, which followed over 3,400 adults for 7 years, found that individuals who regularly used anticholinergics had a significantly higher risk of developing dementia. Specifically, those taking high doses over long periods were at a 54% increased risk. This is particularly concerning given the widespread use of these medications. Many people might not realize that their regular allergy medicine could contribute to cognitive decline. It's crucial for individuals, especially the elderly, to be informed about these risks. If you or someone you know uses anticholinergics frequently, it's important to have a conversation with your healthcare provider. There are often safer alternatives available. For example, nasal corticosteroids can effectively treat allergies without the cognitive side effects associated with anticholinergics. Number 3. Opioid painkillers. Opioid painkillers, such as morphine and oxycodone, are frequently prescribed for severe pain management, especially following surgeries or for chronic conditions. These medications work by binding to specific receptors in the brain and spinal cord, providing effective pain relief. However, they come with potential risks that extend beyond addiction and dependence. Research indicates that prolonged use of opioids can lead to changes in brain structure and function. Studies have shown a reduction in gray matter volume in areas of the brain responsible for memory and decision-making. These alterations can lead to cognitive issues, potentially increasing the risk of dementia over time. The sedative effects of opioids further exacerbate these cognitive challenges, causing drowsiness and difficulty concentrating. One study published in the Annals of Internal Medicine highlighted a significant connection between long-term opioid use and a heightened risk of dementia. This finding underscores the importance of weighing the benefits and risks of opioid therapy, especially for long-term use. So, what can you do if you rely on opioids for pain management? First, it's crucial to have an open dialogue with your healthcare provider. Discuss the potential risks to cognitive health and explore alternative pain management strategies. Non-opioid medications, physical therapy, acupuncture, and mindfulness-based approaches may offer effective relief without the same cognitive risks. If opioids are necessary, work closely with your doctor to use the lowest effective dose for the shortest duration possible. Regular monitoring can help mitigate potential side effects, ensuring your pain is managed while safeguarding your cognitive health. Balancing pain relief with mental clarity is essential for maintaining overall well-being. Number 4. Tricyclic antidepressants. Tricyclic antidepressants, TCAs, such as amitriptyline, nortriptyline are a class of medications primarily used to treat depression, but they also find application in managing other conditions like anxiety disorders, chronic pain, and insomnia. TCAs include drugs such as amitriptyline, nortriptyline, and imipramine, which work by increasing levels of neurotransmitters like serotonin and norepinephrine in the brain. While they can be effective in improving mood and alleviating symptoms of depression, it's important to consider their impact on brain health. One of the concerns with TCAs is their potential cognitive side effects. Some individuals may experience issues such as drowsiness, confusion, and difficulty concentrating. These side effects are more pronounced in older adults, as aging makes the brain more susceptible to medication effects. The anticholinergic properties of TCAs, which can block the action of the neurotransmitter acetylcholine, are partly responsible for these cognitive changes. This blockage can lead to memory impairment and, in some cases, an increased risk of developing dementia. Recent studies have shown a connection between the use of anticholinergic medications, including TCAs, and a higher likelihood of cognitive decline. A study published in JAMA Internal Medicine found that long-term use of these drugs is associated with an increased risk of dementia. This highlights the importance of carefully assessing the need for TCAs, especially in older adults, and exploring alternative treatments where possible. For those currently using TCAs, regular consultations with healthcare providers are essential. Discussing any cognitive changes or concerns with your doctor can lead to adjustments in medication or dosage to minimize side effects. Non-pharmacological treatments, such as cognitive behavioral therapy, CBT, or lifestyle modifications, may also be considered to manage depression effectively while protecting brain health. Number 5. Antipsychotics. Antipsychotics, such as haloperidol and risperidone, are commonly prescribed to manage severe mental health conditions like schizophrenia and bipolar disorder. These medications work by modifying the effects of certain neurotransmitters in the brain, such as dopamine and serotonin, to help control symptoms like hallucinations, delusions, and mood swings. While antipsychotics can be highly effective in managing these severe conditions, prolonged use has been associated with significant risks to cognitive health. Research indicates that long-term use of antipsychotics can lead to cognitive decline and an increased risk of developing dementia. One of the primary concerns is that antipsychotics can cause changes in brain structure and function. Studies have shown that these medications may accelerate cognitive symptoms, including memory loss and impaired thinking. For example, a study published in the British Medical Journal found that elderly patients on long-term antipsychotic therapy had an accelerated decline in cognitive function compared to those not using these medications. Additionally, antipsychotics can cause other severe side effects such as excessive sedation, tremors, weight gain, and diabetes. These side effects can further complicate mental and physical health, making treatment more challenging. For those who need antipsychotics, it is crucial to have thorough medical monitoring. Regular evaluations can help manage side effects and adjust dosages as needed. Number 6. H2 receptor blockers. H2 receptor blockers, also known as H2 antagonists, are medications that reduce stomach acid production. They are commonly used to treat conditions such as gastroesophageal reflux disease, GERD, ulcers, and other digestive disorders. Common H2 blockers include ranitidine, famotidine, cimetidine, and nizatidine. These medications work by blocking histamine receptors in the stomach lining, thereby decreasing acid secretion. While H2 blockers are generally considered safe and effective for managing stomach acid-related issues, there has been some discussion about their potential impact on cognitive health, especially with long-term use. Most people use these medications without significant side effects, but some studies have raised concerns about possible cognitive effects, particularly in older adults. Some research suggests that prolonged use of H2 blockers may be associated with an increased risk of cognitive impairment or dementia in the elderly. However, the evidence is not conclusive, and more studies are needed to determine whether these medications directly cause cognitive decline. Factors such as age, overall health, and the presence of other medical conditions may also play a role in cognitive changes. For individuals concerned about the potential cognitive effects of H2 blockers, it is important to weigh the benefits and risks of these medications. If you rely on H2 blockers for managing acid-related symptoms, talk to your healthcare provider about your concerns. They can help assess your risk and discuss alternative treatment options if necessary. To minimize any potential risks, use the lowest effective dose for the shortest duration possible. Lifestyle changes, such as dietary modifications, weight management, and avoiding triggers like smoking and alcohol, can also help reduce acid-related symptoms without relying solely on medication. Number 7. Antiepileptics. Antiepileptic drugs, such as phenytoin and valproic acid, are crucial for managing seizures in individuals with epilepsy. These medications work by stabilizing electrical activity in the brain, which helps prevent seizures and improves patients' quality of life. However, there are growing concerns about their impact on cognitive health, especially with long-term use. Research shows that prolonged use of antiepileptic medications can negatively affect cognitive functions like memory and concentration. This is because these drugs can interfere with neurotransmitter function in the brain, which is essential for communication between brain cells. Additionally, the sedative effects of many antiepileptic drugs may contribute to drowsiness and difficulty focusing, further exacerbating cognitive issues. A notable study published in Neurology examined the cognitive effects of antiepileptic medications over several years. The research revealed that patients who used these drugs for extended periods had a significantly higher risk of developing dementia. The study highlighted that high doses of these medications were particularly problematic, increasing the risk of cognitive decline. Despite these concerns, anti-epileptic medications remain a cornerstone in the treatment of epilepsy. If you are taking these medications, it's crucial to work closely with your healthcare provider to manage potential side effects. Newer treatments and combination therapies may offer options with fewer cognitive risks. Additionally, adjusting the dose of anti-epileptic medications can help minimize side effects while maintaining effective seizure control. Number 8. Statins. Statins are a group of medications commonly prescribed to lower cholesterol levels in the blood. High cholesterol is a significant risk factor for heart disease, so statins play a vital role in reducing the risk of heart attacks and strokes. Common statins include atorvastatin, simvastatin, and rosuvastatin. These drugs work by inhibiting an enzyme in the liver called HMG-CoA reductase, which is responsible for producing cholesterol. By lowering cholesterol levels, statins help prevent the buildup of plaque in the arteries, which can lead to blockages and heart disease. While statins are effective at managing cholesterol levels, there are some concerns about their long-term use, particularly regarding cognitive health. Studies have suggested that statins might impact memory and cognitive function. For example, some research indicates that statins could be linked to mild memory problems in some individuals, although this is not a universal experience. A study published in the Journal of the American College of Cardiology examined the cognitive effects of statins and found that while some patients reported minor memory issues, these were generally not severe or long-lasting. The benefits of reducing heart disease risk often outweigh these potential side effects. However, if you experience noticeable changes in memory or cognitive function while on statins, it is important to discuss these concerns with your healthcare provider. Number 9. Proton pump inhibitors, PPIs. Have you ever used proton pump inhibitors, or PPIs, to ease stomach problems like acid reflux or ulcers? While these medications can provide significant relief, they may also have hidden risks, particularly concerning cognitive health. PPIs, such as omeprazole and esomeprazole, are commonly prescribed to reduce stomach acid production. They work by blocking the proton pumps in the stomach lining that produce acid. This can help alleviate symptoms of heartburn and prevent damage to the gastrointestinal tract. For many people, PPIs are an effective solution for managing these conditions. However, recent research suggests that long-term use of PPIs may come with potential drawbacks for brain health. Studies have indicated that extended use of PPIs could be linked to cognitive decline and an increased risk of dementia. One reason for this connection is that reducing stomach acid can impair the absorption of essential nutrients needed for brain function, such as vitamin B12 and magnesium. These nutrients are crucial for maintaining cognitive health, and their deficiency might contribute to memory problems and other cognitive issues. Additionally, some research suggests that PPIs might directly affect brain function, although the exact mechanisms are still under investigation. A study published in the Journal of the American Geriatrics Society followed over 1,000 elderly patients and found that those who used PPIs regularly had a higher risk of developing dementia compared to those who did not use these medications. If you rely on PPIs for managing your stomach issues, it's important to discuss these potential risks with your doctor. They might suggest alternative treatments, such as lifestyle changes, dietary adjustments, or less potent antacids, which could provide relief without the same cognitive risks. Number 10. Hormonal contraceptives. These popular medications, especially those that combine estrogen and progesterone, are commonly used to prevent pregnancy and manage various conditions like menstrual irregularities and acne. However, recent research suggests that they might have an impact on cognitive function. Hormonal contraceptives work by altering hormone levels in the body to prevent ovulation and regulate the menstrual cycle. Estrogen and progesterone, the key hormones involved, play significant roles in many bodily functions, including brain health. These hormones are essential for maintaining cognitive functions such as memory, learning, and mood regulation. When their levels are artificially modified over extended periods, it may lead to unexpected effects on the brain. Studies have raised concerns about the potential link between long-term use of hormonal contraceptives and cognitive decline. For instance, research published in the Journal of Women's Health followed women who used hormonal contraceptives for many years. The study found a slight decrease in cognitive function among these women compared to those who did not use such medications. While the exact mechanisms behind this are still being studied, it's believed that altering the natural levels of sex hormones can impact brain function. It's important to note that while these findings are concerning, they are not yet definitive. The relationship between hormonal contraceptives and cognitive health needs further research to fully understand the risks involved. If you are using hormonal contraceptives and have concerns about their impact on your brain health, it's wise to discuss them with your healthcare provider. They can help you weigh the benefits and potential risks and explore alternative options if needed. 10 Early Signs of Dementia. 1. Memory loss. Memory loss is often one of the earliest and most recognizable signs of dementia, but it's more than just occasional forgetfulness. While it's normal to forget where you left your keys or the name of a distant acquaintance, memory issues related to dementia are far more disruptive. Individuals may forget entire conversations, repeatedly ask the same questions, or misplace items in unusual locations, like putting a wallet in the refrigerator. This memory loss often impacts recent events or newly learned information, such as forgetting appointments or instructions shortly after receiving them. Over time, these lapses can interfere with daily routines and responsibilities, causing frustration for both the individual and their loved ones. It's important to note that while everyone experiences some memory changes with age, memory loss severe enough to disrupt daily life is not a normal part of aging. If you or someone you know displays these signs, consult a healthcare professional for evaluation. 2. Difficulty finding words. Struggling to find the right word occasionally happens to everyone, but when it becomes frequent and disrupts communication, it may be an early sign of dementia. People with this condition might pause mid-sentence, searching for simple terms, or replace words with incorrect ones, like calling a watch a hand clock. Over time, these language difficulties can make conversations frustrating or embarrassing, causing the individual to withdraw socially. Another common issue is forgetting names of familiar objects or people. For example, someone might say, "Can you pass that thing?" while pointing to an object they once named effortlessly. They might also lose the ability to follow or contribute to discussions, as organizing thoughts into coherent sentences becomes increasingly challenging. These communication problems go beyond occasional word retrieval struggles and signal deeper changes in the brain's language processing regions. 3. Apathy or loss of interest. Apathy, or a noticeable loss of interest in activities and social interactions, is another subtle early sign of dementia that is often mistaken for depression. Someone experiencing apathy may no longer feel motivated to engage in hobbies, attend social events, or even perform daily tasks they once enjoyed. For instance, a person who loved gardening might suddenly stop tending to their plants without any clear reason. This shift can extend to relationships as well. The individual may withdraw from friends and family, avoid conversations, or show little enthusiasm in situations that previously excited them. Unlike occasional fatigue or mood changes, apathy linked to dementia is persistent and unrelated to external circumstances. These changes occur because dementia affects the brain regions responsible for motivation and emotional regulation. Recognizing and addressing apathy early is vital, as maintaining an active and engaged lifestyle can help slow cognitive decline and improve overall well-being. 4. Frequent falls. While occasional trips or stumbles are normal, frequent falls may indicate a deeper issue, such as early-stage dementia. Research has shown that individuals who later develop dementia are more prone to falls and balance issues years before cognitive symptoms become noticeable. These falls are not simply due to clumsiness or aging but are often linked to changes in the brain's motor control and spatial awareness. For example, someone might trip over flat surfaces, struggle with stairs, or appear unsteady even when walking in familiar environments. These incidents can lead to injuries, further complicating daily life and independence. Falls may also be accompanied by slower walking speeds or changes in posture, like a stooped stance, which are subtle red flags often overlooked. If falls occur frequently or without clear cause, it's crucial to consult a healthcare professional. Identifying the underlying issue early can help address both cognitive and physical health concerns effectively. 5. Disorientation in familiar places. Getting lost in familiar places is a troubling and often overlooked early sign of dementia. This goes beyond simply taking a wrong turn or forgetting an alternate route. It involves losing the ability to navigate spaces that were once second nature. Someone might forget how to get to their favorite cafe, a family member's home, or even back to their own house. This disorientation occurs because dementia affects the brain areas responsible for spatial awareness and memory. People might find themselves unable to follow landmarks or recall familiar routes. They could also feel confused or anxious when trying to retrace their steps, increasing their risk of wandering. This symptom can pose significant safety risks, especially if the individual becomes lost in unfamiliar or hazardous situations. If someone frequently struggles to navigate well-known places, it's essential to seek medical advice. 6. Sleep disorders. Sleep disorders, such as insomnia, excessive daytime sleepiness, or disrupted sleep cycles, can be early indicators of dementia. Many individuals with cognitive decline experience changes in their sleep patterns, such as difficulty falling asleep, waking up multiple times during the night, or feeling unusually drowsy during the day. Certain types of dementia, like Lewy body dementia, may also be linked to specific sleep disturbances, such as acting out dreams, sudden movements, or talking while asleep. These behaviors, known as REM sleep behavior disorders, often appear years before other symptoms. Poor sleep doesn't just disrupt rest, it can worsen memory, mood, and cognitive functioning, creating a cycle that accelerates decline. This connection is partly due to the brain's need for quality sleep to clear toxins and support healthy functioning. 7. Physical changes. Physical changes, such as a stooped posture, slower movements, or difficulty walking, can be early signs of dementia. These changes often stem from disruptions in the brain areas responsible for motor control and coordination. For instance, a person might shuffle their feet, take shorter steps, or struggle to maintain balance, even without other obvious mobility issues. Other subtle signs include trembling hands, reduced grip strength, or difficulty performing tasks requiring fine motor skills, like buttoning a shirt. Such symptoms are often mistaken for normal aging or orthopedic issues, but when paired with cognitive decline, they may indicate an underlying neurological condition. Some types of dementia, like Parkinson's-related or vascular dementia, are particularly linked to these physical symptoms. Monitoring these changes closely is vital, as they can increase the risk of falls and injuries. 8. Struggling with routine tasks. Difficulty performing routine tasks is a significant early sign of dementia, reflecting changes in the brain's ability to process information and follow sequences. These tasks, which were once automatic, become confusing or overwhelming. For example, someone might forget steps in preparing a familiar meal, leave bills unpaid despite reminders, or struggle to follow a simple recipe they've used for years. The individual may also have trouble using everyday devices like a microwave or smartphone, despite having no prior issues. Over time, these struggles can lead to frustration, both for the person and their loved ones, as the loss of independence becomes more apparent. These difficulties go beyond occasional absent-mindedness and indicate a deeper disruption in executive functioning, the brain's ability to organize and execute tasks. 9. Loss of interest in conversations. A noticeable loss of interest in conversations or social interactions can be an early sign of dementia, often linked to changes in cognitive and emotional functioning. Someone with this symptom might become withdrawn, avoiding family gatherings or group discussions. They may prefer silence or fail to engage in topics they previously enjoyed, even with close friends or loved ones. This withdrawal can stem from the person's difficulty in processing and contributing to conversations. As dementia progresses, they may struggle to remember details, follow along with dialogue, or respond appropriately. They may feel embarrassed about their cognitive challenges and retreat from social settings to avoid potential frustration. While temporary fatigue or stress can also lead to reduced social interest, persistent apathy and withdrawal should not be overlooked. 10. Changes in eye movement or focus. Changes in eye movement or focus can be surprising early indicators of dementia, especially in advanced stages of cognitive decline. One sign to watch for is a fixed gaze, where the individual appears to stare blankly or has difficulty shifting their focus between objects or people. This is often linked to reduced attention and concentration, common in neurodegenerative diseases like Alzheimer's or Parkinson's disease. Another notable change is difficulty with depth perception. Individuals might struggle to judge distances, leading to frequent bumps or trips, as well as difficulty navigating familiar environments. In some cases, there can be a noticeable decrease in eye movement, making it harder for the person to track objects or follow conversations visually. These changes occur because dementia can affect the brain's ability to process visual information properly. Now that we've covered the warning signs, let's talk prevention. The good news? Protecting your brain is simpler than you think. Start with these proven strategies. Exercise regularly. Even 30 minutes of walking daily can boost brain health by improving blood flow. Follow a Mediterranean diet. Load up on fish, olive oil, whole grains, and veggies. Stay mentally active. Challenge your brain with puzzles, strategy games, or learning new skills. Socialize. Staying connected with friends and family helps maintain cognitive sharpness. Sleep well. Aim for 7 to 8 hours per night to allow your brain to clear out toxins. Quit harmful habits. Avoid smoking and excessive alcohol while managing blood pressure and cholesterol. If you've noticed any of these signs in yourself or someone you care about, don't ignore them. Early intervention is key to managing dementia effectively. The link between way you sleep and dementia. Did you know that the way you sleep tonight could shape your brain health for the rest of your life? Have you ever wondered if your sleeping position could be the key to preventing memory loss or even neurological diseases like Alzheimer's? Stick around, because today, we're uncovering the fascinating connection between your sleep posture and your brain's ability to heal itself. We often hear about the importance of getting enough sleep, but what if it's not just how much you sleep, but also how you sleep that matters most? Recent research suggests that the position you sleep in might influence your brain's ability to clean itself, potentially affecting your long-term cognitive health. This natural cleansing process involves something called the glymphatic system, a lesser-known but critical part of brain health. If you've never heard of it, you're not alone. It was only discovered in 2012. And it could be the missing link in understanding how sleep quality and posture play into neurological conditions like dementia. What is the glymphatic system? To understand why your sleeping position matters, let's dive into the glymphatic system. Think of it as your brain's nightly cleaning crew. Throughout the day, your brain generates waste products like neurotoxins, including beta-amyloid, a protein linked to Alzheimer's disease. During sleep, the glymphatic system kicks into high gear, flushing out these toxins and keeping your brain functioning at its best. But here's the catch: this system is most active while you're asleep, and the position you sleep in can directly affect how efficiently it works. The science behind sleeping positions. In studies conducted on animals, side sleeping, particularly on the right side, was found to optimize glymphatic activity. This position allows for better circulation and drainage of toxins compared to sleeping on your back or stomach. For humans, researchers have observed similar trends. Side sleeping might enhance blood flow and oxygen delivery to the brain, which is crucial for effective waste removal. Interestingly, people with neurodegenerative conditions like Alzheimer's are more likely to sleep on their backs, a position that can hinder the glymphatic system. This suggests that adopting a side sleeping position could be a simple yet powerful way to support brain health. Why sleep matters more as we age. As we grow older, sleep becomes increasingly important for maintaining brain health, yet it also becomes more elusive. Aging naturally affects our sleep patterns, leading to shorter, lighter sleep and more frequent awakenings during the night. These changes can have serious consequences for the brain, particularly due to the declining efficiency of the glymphatic system. The glymphatic system is most active during deep sleep, clearing out harmful neurotoxins like beta-amyloid and tau proteins, which are linked to Alzheimer's and other neurodegenerative diseases. However, as we age, reduced blood flow and stiffening arteries make it harder for this system to function optimally. Without proper clearance, these toxins accumulate over time, increasing the risk of cognitive decline. Compounding this issue, many older adults sleep fewer than 7 hours per night, which has been linked to a higher risk of dementia. Sleep disorders such as insomnia and sleep apnea are also more common in seniors, further disrupting the cleansing process and exacerbating the problem. The connection between poor sleep and brain health becomes even more concerning when considering the long-term effects. Studies show that early inefficiencies in the glymphatic system can start 15 to 20 years before the first signs of cognitive decline appear. This makes prioritizing quality sleep in midlife critical for preventing memory loss and neurological diseases later on. Thankfully, there are several steps you can take to improve both your sleep quality and brain health. 1. Adopt a brain-healthy sleep position. Sleeping on your side, particularly the right side, has been shown to enhance the glymphatic system's ability to remove waste from the brain. This position allows for better blood flow and oxygen delivery, optimizing the brain's natural detoxification process. If you currently sleep on your back or stomach, consider transitioning to a side sleeping position gradually by using supportive pillows to make it more comfortable. 2. Limit screen time before bed. Exposure to blue light from smartphones, tablets, and computers disrupts melatonin production, the hormone responsible for regulating your sleep-wake cycle. This interference makes it harder to fall asleep and reduces sleep quality. To counter this, avoid using screens for at least an hour before bedtime. Instead, engage in relaxing activities like reading a book, meditating, or taking a warm bath. If avoiding screens isn't possible, consider using blue light blocking glasses or enabling night mode on your devices. 3. Avoid alcohol and heavy meals before sleep. While alcohol may make you feel drowsy initially, it disrupts the deeper stages of sleep, particularly REM sleep, which is crucial for brain health. Similarly, eating a heavy or late meal can lead to discomfort and indigestion, making it harder to fall and stay asleep. Aim to finish your last meal at least 2 to 3 hours before bedtime, and limit alcohol consumption, especially in the evening. 4. Exercise regularly. Physical activity improves circulation, which supports glymphatic function by enhancing blood flow to the brain. Exercise also helps regulate your sleep-wake cycle, making it easier to fall asleep at night. You don't need an intense workout to reap these benefits. Moderate activities like walking, yoga, or swimming can significantly improve your sleep quality. To avoid overstimulation, try to schedule workouts earlier in the day rather than close to bedtime. 5. Create a sleep-friendly environment. Your bedroom should be a sanctuary for sleep. Start by keeping it dark, quiet, and cool, ideal conditions for restorative sleep. Invest in blackout curtains, a white noise machine, or earplugs if necessary. A comfortable mattress and pillows tailored to your sleep position can also make a huge difference. Decluttering your bedroom and reserving it for sleep, and not work or screen time, can reinforce its role as a place of rest. 6. Stick to a consistent sleep schedule. Your body thrives on routine, and maintaining a consistent sleep schedule can help regulate your internal clock. Try to go to bed and wake up at the same time every day, even on weekends. This consistency helps reinforce your circadian rhythm, making it easier to fall asleep and wake up naturally over time. 7. Practice relaxation techniques. Stress is one of the most common culprits of poor sleep, as it activates the body's fight-or-flight response, making it difficult to relax. Incorporate relaxation techniques like deep breathing, progressive muscle relaxation, or meditation into your nightly routine. These practices can help calm your mind and prepare your body for sleep. Mindfulness meditation, in particular, has been shown to reduce insomnia and improve sleep quality by lowering stress levels. 8. Address sleep disorders. If you frequently wake up feeling unrefreshed or experience symptoms like snoring, gasping for air, or daytime sleepiness, you may have an undiagnosed sleep disorder such as sleep apnea. These conditions can disrupt the glymphatic system and increase your risk of cognitive decline. Consult a healthcare professional for proper diagnosis and treatment. Using a CPAP machine or other interventions for sleep apnea, for example, can dramatically improve sleep quality and brain health. 9. Watch your caffeine intake. Caffeine is a powerful stimulant that can interfere with your ability to fall asleep, especially if consumed later in the day. Try to limit caffeine intake to the morning hours, and pay attention to hidden sources like chocolate, teas, and some medications. If you're particularly sensitive to caffeine, consider switching to decaffeinated options in the afternoon and evening. 10. Get natural light exposure. Exposure to natural light during the day helps regulate your circadian rhythm, making it easier to fall asleep at night. Aim to spend time outside, especially in the morning, to reinforce your body's natural sleep-wake cycle. If getting outside isn't possible, consider using a light therapy box to simulate natural sunlight. 11. Incorporate a wind-down routine. Establishing a pre-sleep routine can signal to your body that it's time to rest. This could include activities like reading, gentle stretching, journaling, or listening to calming music. Repeating these activities nightly helps create a predictable pattern, making it easier to transition into sleep mode. 12. Use aromatherapy. Certain scents, like lavender, chamomile, and sandalwood, have been shown to promote relaxation and improve sleep quality. Consider using an essential oil diffuser, pillow spray, or scented candles to create a calming atmosphere in your bedroom. It's clear that sleep is much more than just rest, it's an active process that plays a critical role in maintaining brain health. By prioritizing side sleeping and adopting healthy habits, you can give your brain the support it needs to function at its best, both now and in the future. So tonight, as you settle into bed, think about the position you're sleeping in. It might seem like a small detail, but it could make a big difference in safeguarding your brain health. The different types of frontotemporal dementia. Imagine this: you've known someone for years, and suddenly, they start acting like a completely different person. Maybe they've become impulsive, started saying inappropriate things, or lost all interest in hobbies they once loved. You might think it's stress, depression, or even a midlife crisis. But what if it's something far more serious? This could be an early warning sign of frontotemporal dementia, FTD, a lesser-known but devastating form of dementia that often strikes earlier than Alzheimer's. It doesn't just affect memory, it changes the very core of who a person is. Today, we'll break down everything you need to know about FTD, the symptoms, the science behind it, and whether there are any treatments available. By the end, you'll have a clear understanding of this complex disease and how it differs from other forms of dementia. Let's dive in. FTD is a neurodegenerative disease that primarily affects the frontal and temporal lobes of the brain, areas responsible for personality, behavior, and language. Unlike Alzheimer's, which usually begins with memory loss, FTD often starts with unexplained behavioral changes or speech difficulties. It's the third most common form of dementia, but it's the leading cause of dementia in people under 65. Because of its early onset and unusual symptoms, it's frequently misdiagnosed as a psychiatric disorder. FTD was first described in 1892 by Dr. Arnold Pick, which is why it was originally called Pick's disease. Later, Dr. Alois Alzheimer, yes, the same one who discovered Alzheimer's disease, identified Pick bodies, abnormal clumps of proteins in the brain that are a hallmark of this condition. Over the years, researchers discovered different subtypes of FTD, each affecting the brain in unique ways. That brings us to the key question: what are the symptoms, and how do they differ from other dementias? Frontotemporal dementia isn't a one-size-fits-all disease. It comes in different forms, each affecting distinct areas of the brain and causing unique symptoms. Understanding these types can help recognize early warning signs and provide better support for those affected. Let's dive into the three main types of FTD. 1. Behavioral Variant FTD, BVFTD, the most noticeable change. Behavioral Variant Frontotemporal Dementia, BVFTD, is the most common form of FTD, primarily affecting the frontal lobes, which control personality, decision-making, and impulse regulation. Unlike Alzheimer's, which starts with memory loss, BVFTD manifests through dramatic personality changes, emotional detachment, and poor judgment. A person who was once responsible and kind may become impulsive, inappropriate, or even indifferent to loved ones. They may struggle to recognize social norms, leading to embarrassing or reckless behavior, such as making offensive comments, shoplifting, or showing a lack of empathy in emotional situations. Since they often don't realize their behavior has changed, family members are left confused and frustrated. One of the hallmark symptoms of BVFTD is impulsivity and compulsive behaviors. Patients may engage in repetitive actions like clapping, pacing, or constantly repeating phrases. Eating habits also shift, often leading to cravings for sweets, overeating, or even consuming inedible objects. Some individuals become fixated on routines, eating the same food daily or obsessively collecting useless items. Despite these major changes, they typically retain their memory in the early stages, which makes BVFTD difficult to diagnose and often mistaken for psychiatric disorders like depression or bipolar disorder. As the disease progresses, individuals lose their ability to plan, reason, and regulate emotions, making them increasingly dependent on caregivers. Conversations become difficult as they fail to pick up on social cues, respond inappropriately, or lose interest in meaningful interactions. Unlike Alzheimer's, where patients may recognize their decline, those with BVFTD often remain unaware of their condition, making caregiving particularly challenging. Since there is no cure, management focuses on behavioral strategies, structured routines, and professional support to ensure a better quality of life for both the patient and their family. 2. Primary Progressive Aphasia, PPA, when language starts to slip. Primary Progressive Aphasia, PPA, is a type of frontotemporal dementia that primarily affects language abilities rather than memory or behavior in its early stages. The condition damages the brain's language centers, making it increasingly difficult for individuals to communicate. People with PPA may struggle to find the right words, mix up sounds, or construct sentences correctly, even though their thinking ability remains intact. At first, they might pause frequently while speaking, substitute incorrect words, or have trouble following conversations. Unlike typical age-related forgetfulness, this decline in language skills steadily worsens, leading to frustration and social withdrawal. There are three main subtypes of PPA: non-fluent/agrammatic, semantic, and logopenic. The non-fluent/agrammatic variant makes speech effortful and grammatically incorrect. People may sound as though they are speaking in broken phrases or have trouble pronouncing words. The semantic variant leads to a loss of word meaning, where individuals can still speak fluently but struggle to understand or recognize common words and objects. Meanwhile, the logopenic variant primarily affects word retrieval, causing frequent pauses and difficulty repeating phrases, even though grammar and pronunciation remain intact. Regardless of the subtype, reading, writing, and comprehension also deteriorate over time, making communication progressively more difficult. As PPA advances, individuals may become completely unable to speak or understand language, forcing them to rely on gestures, writing, or assistive communication devices. Unlike other forms of dementia, memory and reasoning skills often remain intact in the early stages, leading to a heartbreaking situation where individuals are aware of their decline but cannot express themselves. Speech therapy, communication aids, and structured routines can help patients maintain their ability to connect with loved ones for as long as possible. 3. FTD with motor symptoms, when movement is affected. Frontotemporal dementia, FTD, isn't just about changes in personality or language, it can also affect movement. Some individuals with FTD develop motor symptoms similar to Parkinson's disease or ALS, amyotrophic lateral sclerosis, leading to difficulties with coordination, muscle stiffness, tremors, or involuntary movements. These symptoms arise because FTD can damage brain regions responsible for motor control, making everyday activities progressively harder. Early signs might include slowness of movement, muscle rigidity, or difficulty with fine motor tasks like buttoning a shirt or holding utensils. Some individuals also experience unexplained muscle twitches or weakness, which can lead to falls, balance problems, or trouble swallowing over time. There are 3 primary motor syndromes associated with FTD: corticobasal syndrome, CBS, progressive supranuclear palsy, PSP, and FTD with motor neuron disease, FTD-MND. CBS causes muscle rigidity, jerky movements, and an inability to control limb movement, sometimes making a person feel as though their arm or leg is acting on its own. PSP affects balance and eye movement, leading to frequent falls, stiffness, and difficulty looking up or down. FTD-MND is closely linked to ALS and leads to progressive muscle weakness, difficulty swallowing, and eventually impaired breathing. Unlike typical FTD, where cognitive and behavioral changes are prominent, motor symptoms may appear first in these cases, making diagnosis challenging. As the disease progresses, individuals with FTD and motor symptoms may become wheelchair-bound, lose the ability to speak, or require assistance with basic functions like eating and dressing. Since these conditions have no cure, treatment focuses on physical therapy, speech therapy, and assistive devices to maintain independence for as long as possible. While medications can help manage stiffness or spasms, the condition continues to worsen over time. Understanding these motor symptoms is crucial, as early recognition can help individuals and their families prepare for the progressive challenges ahead. How is FTD diagnosed? Diagnosing frontotemporal dementia, FTD, can be challenging because its symptoms often overlap with other neurological or psychiatric conditions, such as Alzheimer's disease, Parkinson's, or even depression. There is no single test for FTD, so doctors rely on a combination of clinical evaluations, brain imaging, and cognitive tests to make a diagnosis. The process typically begins with a detailed medical history and a discussion of symptoms, particularly focusing on behavioral changes, language difficulties, or motor impairments. Neurological and cognitive assessments help evaluate memory, problem-solving skills, and language abilities. Brain imaging tests like MRI, magnetic resonance imaging, or PET, positron emission tomography, scans are crucial in identifying frontal and temporal lobe shrinkage, which is characteristic of FTD. In some cases, genetic testing may be recommended, especially if there is a family history of FTD-related disorders. Because FTD can mimic other conditions, misdiagnosis is common, and many patients are initially treated for psychiatric disorders before receiving a correct diagnosis. Consulting a specialist in neurodegenerative diseases can improve diagnostic accuracy. Early detection is essential, as it allows individuals and families to plan for care, explore treatment options, and participate in clinical trials that may offer future hope. Is there a cure or treatment for FTD? Currently, there is no cure for frontotemporal dementia, FTD, and no treatments can stop or reverse its progression. However, several strategies can help manage symptoms and improve quality of life. Medications such as antidepressants and antipsychotics may be prescribed to help control behavioral symptoms like agitation, compulsive behaviors, or emotional instability. Unlike Alzheimer's, FTD does not typically involve memory loss in the early stages, so standard dementia medications like cholinesterase inhibitors are not effective. Speech and language therapy can be beneficial for individuals with primary progressive aphasia, PPA, helping them maintain communication skills for as long as possible. Occupational and physical therapy can assist those with motor symptoms, improving mobility and coordination. Additionally, behavioral interventions and structured routines can help manage impulsive behaviors and maintain independence. Since FTD is a progressive disease, long-term care planning is crucial. Support from caregivers, family members, and specialized support groups can make a significant difference in navigating the challenges of FTD. While research is ongoing, clinical trials are exploring potential treatments that target the underlying causes of FTD. Staying informed about these developments offers hope for future advancements in treatment and care. Frontotemporal dementia may not be as well known as Alzheimer's, but its impact is just as devastating, especially since it often affects people in their 40s, 50s, and 60s. Best foods to detox your brain. 1. Green leafy veggies. If you're looking for a natural way to detox and revitalize your brain, green leafy vegetables are a must. Spinach, kale, Swiss chard, collard greens, arugula, these vibrant greens are nutritional gold mines. So, why are they so special? For starters, green leafy veggies are packed with chlorophyll, which is like a cleanser for your cells, removing toxins and improving oxygen flow. They're also rich in vitamin K, a nutrient essential for cognitive function and memory. Vitamin K helps to regulate calcium levels in the brain, reducing oxidative stress and preventing cell damage. But that's not all. These greens are loaded with lutein and beta-carotene, powerful antioxidants that protect your brain from free radicals. Think of these compounds as tiny shields, defending your brain from daily wear and tear caused by pollution, stress, and even poor diet. Lutein has even been linked to better cognitive performance and slower brain aging. Let's not forget folate, a vitamin crucial for DNA repair and the production of neurotransmitters like serotonin and dopamine. Without enough folate, your brain's ability to detox and repair itself diminishes over time. Folate from greens is also easily absorbed by your body, making it a natural way to boost mental clarity. Green leafy veggies don't just clean house in your brain, they also help your body remove heavy metals like mercury and lead, which can accumulate over time and impair cognitive function. These toxins are trapped and escorted out of your system, leaving your brain free to function optimally. Incorporating these greens is easy. Toss some spinach into your smoothie, whip up a kale salad, or sauté some Swiss chard with garlic for a simple side dish. Your brain will feel the difference. 2. Berries. These small but mighty fruits, like blueberries, strawberries, raspberries, and blackberries, are packed with nutrients that can detoxify your brain and enhance your cognitive function. What makes berries so special? The secret lies in their high levels of flavonoids, which are powerful antioxidants. Flavonoids combat oxidative stress, a process that can damage brain cells and lead to memory issues over time. Think of flavonoids as a cleanup crew, clearing out the toxins and free radicals that slow down your mental sharpness. But the benefits don't stop there. A study from Harvard found that women who consumed 2 or more servings of strawberries or blueberries per week delayed memory decline by up to 2.5 years. That's like turning back the clock on your brain. These little fruits are also known to improve communication between brain cells and even stimulate the formation of new ones, thanks to their high content of anthocyanins, a specific type of flavonoid. Berries are also rich in vitamin C, another potent antioxidant that helps protect your brain from aging and supports the immune system. They even contain fiber, which aids gut health, and here's a fun fact: a healthy gut is directly linked to a healthy brain. Incorporating berries into your diet is incredibly easy and delicious. Add them to your morning oatmeal or yogurt, blend them into a smoothie, or enjoy them fresh as a snack. Even frozen berries retain their nutrients, making them a convenient option year-round. So the next time you're craving something sweet, skip the processed treats and go for a handful of berries. Your brain, and your taste buds, will thank you. 3. Walnuts and seeds. Have you ever noticed how a walnut looks like a tiny brain? That's no coincidence. Walnuts and seeds are among the best foods you can eat for brain detox and overall mental health. They may be small, but their nutrient profile packs a big punch when it comes to supporting cognitive function and clearing out toxins. Let's start with walnuts. These brain-shaped nuts are rich in omega-3 fatty acids, particularly alpha-linolenic acid, ALA, which is essential for brain health. Omega-3s help repair damaged brain cells, improve communication between neurons, and reduce inflammation that can contribute to cognitive decline. Studies have even shown that regular walnut consumption can improve memory and focus. But walnuts aren't the only stars here. Seeds like flax seeds, chia seeds, sunflower seeds, and pumpkin seeds are equally powerful. These seeds are full of essential nutrients, including magnesium, zinc, vitamin E, and more ALA. Magnesium helps calm the nervous system, reducing stress and improving brain function. Zinc is critical for neurotransmitter function, while vitamin E acts as a potent antioxidant, protecting your brain from damage caused by free radicals. Another key benefit of walnuts and seeds is their ability to support detoxification. Their high fiber content aids in removing waste and toxins from your system, indirectly supporting your brain's health. Plus, they contain polyphenol and other compounds that reduce oxidative stress in brain cells, keeping your mind sharp and clear. Incorporating these superfoods is simple. Snack on a handful of walnuts, sprinkle chia or flax seeds on your yogurt or smoothie, or add sunflower and pumpkin seeds to your salads. They're versatile, delicious, and incredibly good for you. 4. Fish and seafood. Ever heard the phrase fish is brain food? It's not just a saying. Fish and seafood are some of the most effective foods for detoxing and nourishing your brain. Packed with essential nutrients, they play a vital role in maintaining mental sharpness and long-term brain health. The key to their brain-boosting powers lies in omega-3 fatty acids, particularly DHA, docosahexaenoic acid. DHA is a crucial structural component of your brain, making up a significant portion of the gray matter. It supports the growth and repair of brain cells, enhances communication between neurons, and reduces inflammation, which is often linked to cognitive decline. Simply put, your brain can't function at its best without enough DHA. Fatty fish like salmon, mackerel, sardines, and trout are the best sources of omega-3s. Regular consumption of these fish has been shown to improve memory, focus, and overall cognitive function. Some studies even suggest that a diet rich in omega-3s can reduce the risk of neurodegenerative diseases like Alzheimer's. Shellfish and seafood like shrimp, oysters, and crab are also excellent for brain health. They're rich in zinc, selenium, and vitamin B12, which are critical for detoxification and energy production in the brain. Another benefit of seafood is its role in removing toxins. The nutrients in fish support liver function, which helps your body eliminate heavy metals and other harmful substances that can accumulate in your brain. To maximize the benefits, aim for 2 servings of fatty fish per week. If seafood isn't your thing, high-quality fish oil supplements can also provide the DHA your brain needs. 5. Coffee. Coffee, when enjoyed in moderation, is packed with brain-boosting benefits that might surprise you. This beloved beverage is more than a caffeine fix, it's a powerful tool for brain detox and cognitive enhancement. Let's start with caffeine, coffee's most famous component. Caffeine works by blocking adenosine, a chemical in your brain that makes you feel tired. This not only helps you stay alert but also improves focus, reaction time, and even short-term memory. But coffee is more than just caffeine. Coffee is loaded with antioxidants, including chlorogenic acid, which helps combat oxidative stress and inflammation in the brain. These antioxidants act as a detox squad, clearing out harmful free radicals and reducing the risk of cognitive decline. Research even suggests that regular coffee drinkers have a lower risk of neurodegenerative diseases like Alzheimer's and Parkinson's. Moderate coffee consumption has also been linked to improved mood. The caffeine in coffee stimulates the production of dopamine and serotonin, the brain's feel-good chemicals, which can help reduce stress and boost mental clarity. For the best brain benefits, opt for organic, freshly brewed coffee to avoid exposure to pesticides and maximize its antioxidant content. Keep it simple, black coffee or a splash of plant-based milk is ideal to avoid added sugars and artificial flavors that could counteract the benefits. How much is too much? Stick to 1 to 3 cups per day, as excessive consumption can lead to jitters or disrupt sleep, which is vital for brain detox. 6. Dark chocolate. Dark chocolate isn't just delicious, it's a secret weapon for brain health and detoxification. But don't reach for any old chocolate bar, we're talking about high-quality, dark chocolate with at least 70% cacao. What makes dark chocolate so special? It's packed with flavonoids, a type of antioxidant that's particularly beneficial for your brain. Flavonoids improve blood flow to the brain, enhancing oxygen delivery and supporting cognitive functions like memory and focus. They also protect brain cells from oxidative stress, a major factor in cognitive decline and neurodegenerative diseases. Dark chocolate is also rich in magnesium, a mineral known for its calming effects on the nervous system. Magnesium can help reduce stress and improve sleep, both of which are essential for brain detox. Additionally, it contains small amounts of caffeine and theobromine, which provide a gentle energy boost and enhance mental alertness. One fascinating benefit of dark chocolate is its ability to encourage neuron and blood vessel growth in areas of the brain related to memory and learning. A 2013 study found that cacao flavonoids may even help repair brain cells and improve connectivity between neurons. The best part? Incorporating dark chocolate into your diet is easy and indulgent. Enjoy a small piece after dinner, add cacao nibs to your smoothie, or mix it into oatmeal for a brain-boosting treat. Just remember to choose dark chocolate with minimal added sugar and avoid overly processed options. So, the next time you're craving something sweet, skip the sugary snacks and savor a piece of dark chocolate. It's a guilt-free way to boost your mood, enhance mental clarity, and show your brain some love. Because who says brain health can't be delicious? And there you have it, the ultimate brain detox foods to keep your mind sharp, clear, and energized. Incorporating these into your daily routine can make a big difference in your cognitive health and overall well-being. Whether it's a handful of walnuts, a piece of dark chocolate, or a colorful berry bowl, every small choice adds up. If you found this helpful, don't forget to like, subscribe, and share. With that said, thanks for watching, and until next time.